This viral disease is related to smallpox. It's known as monkeypox because it was first found in colonies of monkeys, but the virus infects other animals and humans too. How do you become infected? When this virus spreads from person to person, it's usually through close skin-to-skin contact. It spreads through the intimate contact that happens during hugging, kissing, and sex. You can catch it by touching an infected person's rash, scabs, or body fluids. You can get it by touching contaminated clothing, bed sheets, or surfaces. If you're face to face with an infected person, they can pass it to you through coughs, sneezes, and breathing, and a pregnant mother can pass it to her unborn baby. You can also catch the virus by handling an infected animal. This is especially true if you touch its blood or sores. You can get it from a bite or a scratch. And it can spread through infected meat or animal products. Who's at risk? Anyone can catch or spread this virus. But we're seeing the greatest spread among gay and bisexual men and among other men who have sex with men. What are the symptoms? An infection usually begins with fever, chills, and headache. You have muscle aches, swollen lymph nodes, and exhaustion. Within days, you develop a rash. It often shows on the face, mouth, or other parts of the body like the hands, feet, chest, genitals, or anus. The rash causes flat red bumps on your skin. These turn into raised, pus-filled blisters. After a few days, the blisters form crusty scabs which fall off. It takes 2 to 4 weeks for the virus to run its course. How do we treat it? If you have a rash that looks like monkeypox, it's important to talk to your healthcare provider. Most people will get better on their own without treatment or with medications to relieve symptoms. Infections are rarely fatal, but if you have a severe infection, your doctor will create a plan that's right for you.